I'd like to introduce the panel, and I'd like to let you all know this is our first full patient segment for patients, by patients, and we're excited to do this. It's important that we keep the dialogue flowing between patients. We are all individuals in our kidney cancer journey, but yet we are the same. We all want the same outcome, a cure. And we want the best treatment that we can get along our journey. I hate to use that word journey, but for the moment, that's all we have. So first I have Karen, and she's going to share her story. Then I have Heather sitting next to her. She's going to share her story. Amanda is going to share her and her father's story. And Mike there at the end, our lone fella, is going to share his story. We're going to let each of them talk first, and then we're going to open up so that we can have a dialogue between you patients and we patients, and maybe we can come to some conclusions that will help direct Kidney Cancer Canada on what issues we need to address and where we might be able to go, and maybe provide information for you or some like experiences that will help you in your kidney cancer experience or your family member or your caregiver. As Stephen said, I am a patient. I am over 7 years now active surveillance. It is not for everyone, I will say, but I'm still very fortunate, and I'm touching wood, that my tumor has grown very minimally. I'm being well cared for, and I found the right doctor through Kidney Cancer Canada. My first experience was, I live in a very rural area, so I advocate mostly for rural and remote. And I was sent to a regional hospital, and the doctor, it was found incidentally, and he said, oh, hey, don't worry about it. Come back in a year, we'll take a look and see. Now for me, that would have been okay. For many other patients, that would have been a death sentence. And so I knew in my heart that that wasn't the right answer. So I contacted Kidney Cancer Canada, and they helped me find the right doctor, a Dr. Coleman'sberger in Toronto. He's not the Dr. Coleman'sberger, I actually see Dr. Jewett, who's now retired, but there is the right doctor for you out there, and it's so important for you to advocate for that right doctor. I can't stress that more.
So my name's Karen Eagleson. I'm from Ottawa, and I was diagnosed in 2008, so I'm celebrating 10 years this year. And I have metastases in my lungs currently, very tiny. I was lucky enough, I had my nephrectomy in 2008, and my cancer, it was very large. I had a 14 by 18 centimeter tumor. It was huge. But I was very lucky afterwards to not have any metastases for 7 years. And then I had some metastases come back in my lung, and I've been dealing with those since then. 2 points I wanted to make. First off, is about trials. If you're interested in a trial, make sure you get really well informed and that you really understand all aspects of it. I was in the ASSURE trial, which was the adjuvant trial back in 2008, but I had some real issues with side effects very quickly on, very, very early on. And I was sort of rushed into the trial at the last minute before Christmas break that year. And because I was having issues and I was trying to contact the doctors, and it was Christmas holidays and so on and so forth, I was dealing with on-call oncologists, not my own. There ended up being a miscommunication. I was told to stop the drug until I could get in and see my doctor and get some prescriptions and whatnot to help with the side effects, and then carry on again. Unfortunately, through miscommunication, they booked me to see my doctor. I went in, and it turned out I was 2 days too late to restart the drug. They booked me too late to get back on it. And that was within the parameters of the trial, but I was not aware of that. And they messed up the timing by not bringing me in soon enough. So really important that you understand everything about the trial that you're going in, just in case there's a miscommunication somewhere. So that's one thing. And of course, for me, that sent me into a real depression, because I felt like I'd lost my only chance to do what I could to stop it from coming back. Anyhow, the other thing is, if anybody's interested in talking about it, is my lung met so far, I've had 4 VATS surgeries, video-assisted thoracic surgeries, to remove my lung mets when they were very tiny, less than a centimeter. I was not comfortable with the watch and wait. I wanted them out. So I've had 4 surgeries for that. And it's gone well for me. Unfortunately, I now have a couple of new tiny ones, less than half a centimeter. So we're in the midst of deciding what we're going to do from here on in. But those are 2 issues, trials and VAT surgeries, that I'm happy to talk about with anybody.
Thank you, Karen.
I'll try not to go over my allotted time and get electrocuted. My name is Heather Corbett. I'm 53 now, and 10 years ago I was 43, so younger than the average kidney cancer patient. I had low hemoglobin was my only symptom, and a bit of cough, which they said was not related. And after a multitude of tests, I finally was discovered to have a large tumor on my left kidney. Was within 2 weeks I had surgery by a urologist at my local hospital and had a left radical nephrectomy. The pathology came back and I was stage 3B with no lymph node, no metastases. But my surgeon had heard about Princess Margaret study going on, so he referred me down. I met with Deb Maskins in the deli of Princess Margaret. I found her through a newspaper article, and she met with me, and it was great support. She had lots of good questions, lots of good points for me to ask, whether when I was going up to find out about the study, and also on Kidney Cancer Canada, to find other people that had kidney cancer and to see that they were still around, and to talk with people, always searching for somebody similar situation to I was. In the end, I was not qualified. I didn't qualify for the study because during my surgery, I had pulmonary embolisms, blood clots in my lungs, so I didn't qualify for the study. But I was continued to be followed at Princess Margaret, which was a reassurance to me, because if something else came up, a new study or something, or if my cancer did come back, I was already a foot in the door for anything that should arise. I didn't go on any chemo at all, as I said. Emotionally, kidney cancer was a bit of a torture. It consumed my life. I studied it nonstop. I had to go back to work or I'd be absolutely crazy. So I went back to work after 8 weeks. And just when I got to 4 years, I was followed 3, 6, 9 months and so on. I got to 9 months of CT scans, and my CT was clear, but my regular physical showed my hemoglobin was low again. And that's a telltale sign for me. So my doctor, my GP, who is my lifesaver, she actually kept doing tests, and I had everything under the sun. Capsule endoscopy, excuse me, is the one that found my metastases, and it was in my small bowel. At the time, they said it wouldn't be kidney cancer. Kidney cancer doesn't go to the small bowel. And I said, well, I don't do anything by the book, so don't be surprised if that's what it is. And the surgeon said, he's about to retire. He's never seen it in his life. And he called me several days later, longer than expected, with the pathology to tell me that, in fact, it was metastases. But by then, it was already removed. So again, no chemo. They wouldn't have done radiation on the bowel anyway, too toxic or something. So luckily, I've had my kidney cancer come back in removable parts, and I have not had to have any chemo, which is, sometimes I think maybe if I'd have had the chemo after the first surgery, maybe I wouldn't have had it in my small bowel, but who really knows? But I didn't have side effects, so I had, good couple of years being healthy, and I'm healthy now. So again, this is the first time in 10 years that I've gone a full year without a CT scan, so I should be glowing in the dark now, I think. I've always found Kidney Cancer Canada always had a speaker about what I was starting to question or what I was looking into. So I found the meetings really good, as well as speaking to other patients. But I can remember at one point going to a meeting and everybody was talking about chemo and patients were on chemo and I wasn't. And I started to feel like I didn't belong. Like, why am I still going to these meetings? And then I remembered the reason why I did come out to the meetings was to find other patients that were still doing okay, And in the beginning, everybody was new to it, so there wasn't any real 10-year survivors. And that's why I come out, to say, hey, I've had it twice and I'm still here and I'm doing okay. So I do have a YouTube video with my full story and complications of my surgery on YouTube, but so if you want to watch that, just search Heather kidney cancer and it comes up. Or you can talk to me later. I like to talk.
Thank you, Heather. Amanda, can we move to you?
Sure. Hi, my name is Amanda Hancock, and just before I get started, like Heather said, I think the peer-to-peer support is huge. Without a website like smartpatients.com, that was our kind of major resource that helped us talk to other patients. They gave suggestions on doctors in different areas, and it was a lifesaver for our family. My dad was 56 when he got diagnosed with metastatic, kidney cancer. And I was 7.5 months pregnant at the time, and I took on the role of advocate. My brothers would probably tell you that I'm the go-to kind of thing to do the research and do the talking. So we went to a urologist, and we had a not so great first consultation. That's why I got up and applauded Stephen and his doctor for showing that kind of respect, mutual respect. Within 5 minutes, I would think the word incurable and inoperable was said a million times. And that's what it seemed like. At that point, we had only been probably a couple weeks before we knew that there was something wrong. We waited a couple weeks for the urology appointment. And why I'm talking so much about that initial appointment, because I really feel in my heart that we were rushed through it, not given a whole lot of information, shoved out the door, and even when, I had researched and said, I think, surgery is a great option, and even mentally, just to get your kidney out or that part out, it serves a purpose. And my father, because I was kind of speechless, my father spoke up and he said, well, can we go to the US? Because being naive and not having a lot of information, that's the first thing that came to our heads. And he blatantly said, no, we consult with doctors from the US, and they're going to give you the same opinion. And that was it. We left. And we were sent for blood work, and we were going to be sent to St. John's. And we have a lot more to our story, but that initial visit set the tone for our journey and my dad's journey. It was a uphill battle. Not, kidney cancer, we learned, is rare, and it needs expertise. I think one person said, if you bought a Lamborghini, you wouldn't take it to the guy down the street. You'd take it to the proper mechanic. And we fought, and the advocacy part of it, I put in hours. Sorry. And I think that's super important. I'm pretty polite before this, or I was pretty polite. And, I would take no for an answer, and I wouldn't speak up. And my father, he built a company, a construction company, and I just want to tell you that because I want you to understand the person he was. He was absolutely driven. The bigger the challenge he was, the more excited he was. So, I can hear him now saying, just come on with it. Whatever you got, come on with it. But that initial visit, that tore him down. And I'd like to say that, and I've seen it for myself, because we did find doctors in other areas, and we had to fight tooth and nail to see them. And in the U.S., we did go to the U.S. because it was just quicker, faster, and easier. The restraints in rural Newfoundland, second opinions are very hard to come by. We were pretty much, we wanted to have second opinions or change doctors even because of our negative experiences. And we were told no. And as a patient, that is your right. We were told that a little bit too late. And if I can share that with people, I think that's my biggest thing, is that this is your life, and you know exactly what's going on with your body. You know yourself better than anyone, and this is your ship to steer. Find your first mate, which is your doctors and your medical team, and get the support of your family and friends, the ones who will talk for you and the ones who will listen. So I'm at a time, but if anyone would like to talk. My dad, yes. Within 2.5 weeks of that urology visit, we were in the US, and my dad had his radical nephrectomy and recovered like a trooper. And I seen the difference when we were with the doctor who was driven as well to cure kidney cancer. So when you find that expertise and you find that compassion and respect, my dad's attitude changed so much because he knew he had the support. So I think you can tell when you meet with your doctor or your oncologist, and those doctors who are going to say, yeah, sure, go ahead and get a second opinion. Those are the doctors that are confident enough in their decision of your proper treatment, and also they're willing to learn. So I think those doctors are they're gems. They're absolute gems. And if you can find them, we had doctors like that in the US, and not to say we don't have them in Newfoundland, we just had trouble finding them, because we did find them. But then going back to Newfoundland, some of our doctors didn't want to deal or work with other doctors, and that's a red flag. That's a red flag, because any doctor who's willing to learn and willing to listen and is respectful is going to jump at the opportunity to see what another doctor says, right? One, they can be validated, and two, they can learn something. So those are your doctors, and I could talk forever, but anyways.
Thank you so much, Amanda. You have made some very valuable points. And that is why Kidney Cancer Canada is advocating so much for rural and remote areas, that we need to make sure that they get the expertise that they need. And I'm going to move to Mike now. And Mike, could you please share your story?
Hi, everybody. My name is Mike Sinodhinos. I'm here today with my wife, Elle. We have a son at home, Jacob, who turns 7 next month. And I guess I'll just run through my story and experiences with kidney cancer. It started 4 years ago when a tumor was found in my left kidney, incidentally. We quickly had a left radical nephrectomy. And I did pretty good for about 2 years, lived life normally. But after 2 years, we found out that it came back. It had gone metastatic. And it's a grade 4 tumor originally. So pretty aggressive and fast growing when it decides to do that. So when I found out that it went metastatic, I went to the oncologist that I was seeing at the time, and we weren't happy with what was happening with this oncologist. So we made the decision to look elsewhere. And with the help of Kidney Cancer Canada, we found Dr. Bjornison. That was the best decision of my life, finding Dr. Bjornison. He's a fantastic doctor. So the next 2 years up until now have been pretty eventful. So I'm going to quickly just go through the last 2 years just to give you an idea of the journey I've had since this disease went metastatic. Initially started a trial. The trial was atezo and beva versus Sutent. I ended up on the Sutent arm of the trial, so I started Sutent. Couldn't tolerate Sutent on the terms of the trial, so eventually came off of the trial and stayed on Sutent through Dr. Bjornison's direction, and we were able to get things under control. You know, we had complications along the way, but it was far easier to tolerate with Dr. Bjornison's direction, that rather than just 28 days on and 7 days off. It didn't work for me. My liver didn't like it at all. So we continued adjusting Suitent and found a good combination of days on and days off and a good dosage that I was able to tolerate. At that point, I started to cough, went through a couple of bronchoscopies, eventually did a core-out procedure to clear out my bronchus, and the bulk of my problems are on my left lung. So that's where we did the bronchoscopies and the core-outs. Eventually, things got pretty stable, and I ended up back to work. And after a couple of months, things progressively got worse. My breathing was worse, coughing got worse, and that's where, again, more bronchoscopies. Ended up with a blocked left lung, pneumonia, and eventually led to a collapsed lung. My lung's still collapsed now, but we're still working through different things to try and resolve that. So at that point, the decision was made to try and do a VATS lobectomy. The bulk of my problems were in my lower left lobe, so we tried to surgically remove the lower left lobe and remove the bulk of the problems. Unfortunately, that surgery didn't work out. The tumor was larger than they expected, and they couldn't isolate it, so that was abandoned. About a month later, after I healed, we decided to try SBRT radiation in the same area, and that was effective. It didn't cure anything. It slowed things down, but still had some issues there. There were some complications from the SBRT, which we can go into afterwards. If anybody wants to ask questions about that, that's fine. Now, about 3-4 months after that SBRT radiation, I think on the follow-up CT scan, we found a tumor in my third rib on the lateral side, on the left side. Again, hit that with SBRT, and that worked out well for that area. After that, I found some more stabilization with the disease, and that's when, again, I ended up with more problems with my left lung. More core-out procedures to try and clear out that left bronchus. That was dealing with the collapsed lung. And I think at that point, that's when we decided to stop Suitent and move to nivolumab. It seemed pointless to continually have to go in and clear out this tumor that kept coming back. Suitent kept a lot of the disease stable in other areas, but I kept having to have these surgeries to clear out my lung, and it was the interval in between surgeries was getting shorter and shorter and shorter. So the decision was made to stop Suitent and move to nivolumab. Again, after switching from Suitent to nivolumab, more tumors were found. I ended up with 2 tumors on my spine, T10 and T11. And then the same third rib I had a tumor on before, but now in my back. And so again, more SBRT radiation. And so far, these tumors seem to be stabilized. So this SBRT radiation seems to be effective. That's only recently that I've gone through that. That was about 6 to 8 weeks ago. And most recently, to try and deal with the collapsed lung, is I've started brachytherapy, which is an internal radiation for those of you that don't know, that was started, my first treatment on that was on Thursday, and so it's made my voice a little bit raspy, but the left bronchus is completely blocked. They tried to get through that blockage, but weren't able to, so I'm due for 1 or 2 more brachytherapy treatments, but before then, they want another core procedure done, and then they'll continue with the brachytherapy and hopefully get to the lower lobe and hit what's going on down there. And that takes us basically to present day.
Say thank you so much, Mike. I'm so glad that you're here today to share with us. You did bring up one very important point. I was so happy to hear that your doctor adjusted your therapy rather than stopping your therapy. I think it's important that sometimes we make rash decisions without all the thought process going into it. It's an individual choice between you and your doctor, and you need to have that conversation, but sometimes we as patients don't take that initiative. We need to know that the patient voice is an important one. This is your body, this is your treatment, and you need to be respected for your opinion.